How to tell if a cat is pregnant. The typical gestation period for cats is about 9 weeks, and a pregnant cat will begin to display telling physical and behavioral changes soon after becoming pregnant. If you know how to spot these changes, it can help you determine if your cat is indeed pregnant. The best way to know for certain, though, is of course to take your cat to the vet. Unless you're a professional cat breeder, you should have your cat spayed. Overpopulation among cats is a significant problem that results in many cats having to be euthanized when they can't find a home. Part 1: Recognizing signs of fertility. 1. Determine if your cat is fertile. If your cat is fertile and has recently been in heat, it's possible that she may be pregnant. Female domestic cats become sexually active as the days get longer and the weather gets warmer, typically between spring and fall. A female cat may start her estrus cycle, go into heat, once the weather becomes warmer and she has reached about 80% of her adult weight. This means a cat may go into heat as early as 4 months of age in unusual cases. 2. Watch for mating behaviors. When a cat goes into heat, she displays clear behavioral changes meant to attract a mate that will last about 4 to 6 days. A cat about to go into heat will initially display signs of restlessness, become more affectionate, begin making low calls, and have increased appetite. When a cat enters into heat, she will begin calling, meowing or mewling frequently and insistently, and may lose her appetite. A cat in heat will become much more affectionate towards people, will roll around, and will prop her hind quarters up in the air while treading her back paws and holding her tail to the side. 3. Understand the implications of a cat in heat. If your cat has gone into heat, the effects can extend much further than odd behavior. Your cat could have gotten pregnant. If you determine your cat has recently been in heat, pregnancy is a definite possibility. After being in heat, a cat will enter into a quiet phase lasting about 8-10 days, during which her behavior will calm down. Following the quiet phase, however, your cat will go into heat again and continue to go into heat through the period between April and September. To prevent your cat from going into heat or inadvertently getting pregnant, have her spayed as soon as it's safe to do so. Part 2: Looking for signs of pregnancy. 1. Check for enlarged nipples. About 15-18 days into the pregnancy, a queen's nipples will pink up, or become red and enlarged. Her breasts may enlarge, and she may express a milky fluid. Enlarged nipples are also signs of being in heat, so bear in mind that growing nipples are not exclusively indicative of pregnancy. 2. Look for a characteristic burrow shape. From the side, pregnant cats frequently look somewhat sway-backed, with a slightly round and bulging abdomen. Many female cats assume this burrow shape later in pregnancy. If your cat is merely overweight, she'll be heavier all over, including her neck and legs, and not just in her abdomen. 3. Notice any nesting behavior. A few days before she'll give birth, your cat will begin showing nesting behaviors as she prepares for the arrival of her litter. Your cat may go to a quiet place like a closet and start arranging blankets, towels, or other fabric to create a place to give birth to her kittens. If you notice nesting behavior and you hadn't previously realized your cat was pregnant, take your cat to the vet as soon as possible for a prenatal checkup. Part 3: Caring for a pregnant cat. 1. Take your cat to the vet if you think she may be pregnant. The vet can confirm the pregnancy and advise you on caring for the cat. Ask your vet about caring for the queen and preparing for the birth. Have the vet examine the queen's stomach. After about 17-25 days, an experienced veterinarian can usually feel the embryos. Leave feeling for embryos to the vet. Your prodding could lead to a miscarriage. 2. Ask for an ultrasound. If the vet is unsure after feeling your cat for embryos, they can instead use an ultrasound to determine whether or not your cat is pregnant and, if so, with how many kittens. The vet will be able to detect fetal heartbeats by 20 days into the pregnancy with an ultrasound. 3. Ask the vet to take radiographs, X-rays. At approximately 45 days of gestation, the skeletons of the kittens can be seen with an X-ray, which will confirm the pregnancy and the number of kittens in the litter. The vet will typically take 2 X-rays in order to get views of the abdomen and count kittens, while also looking for potential problems. These X-rays will not hurt the queen or the kittens. An X-ray is better for counting fetuses than an ultrasound, though it still isn't 100% accurate. 4. Avoid getting vaccinations, deworming, or giving medications to your cat if she's pregnant. Vaccines in particular may be dangerous to the queen or her kittens during gestation. Consult your vet before giving any medications, including dewormer, to the queen or, after she gives birth, to the kittens. 5. Increase her caloric intake in the last few weeks of her pregnancy. You may notice your cat consuming more food and gaining weight as she gets closer to giving birth. Because the kittens are developing rapidly during the last third of pregnancy, you should feed your cat a growth, kitten, formula diet to provide sufficient calories. 6. Keep the queen inside during the last few weeks of pregnancy. As your cat gets closer to giving labor, be careful to keep her inside so that she won't find a place outside to give birth to the kittens. It's best if you prepare a nest or whelping box for her inside the house. Place a box in a warm, dry, quiet place in the house and line it with newspaper or an old towel or blanket. Set your cat's food, water, and litter box nearby and encourage her to sleep in the box in the days leading up to the birth. Warnings. Millions of homeless cats are euthanized each year due to overpopulation. Please have your cat spayed to avoid contributing to this problem. Spay your cat before she's 5 to 6 months old so that she doesn't become pregnant. Some veterinarians offer to remove the pregnancy or spay a pregnant cat. Some don't recommend doing this beyond a certain point in the progression of the pregnancy, while others perform the surgery at any point during the pregnancy. Cats don't typically experience morning sickness, so if your cat begins to vomit frequently or show other signs of being unwell, take her to the vet.